Hey guys, this is Dr. Hub. Today we'll look at the adverse effects of drugs which are given to the infants. So we start off with oxygen. So what is the adverse effect of oxygen? There may be retinopathy of prematurity. We are writing it as ROP. Next, there is also the bronchopulmonary dysplasia. Bronchopulmonary dysplasia. Then on administration of chloramphenicol. So in terms of chloramphenicol, they can be the grey baby syndrome. There is presence of the grey baby syndrome. And there is also the bone marrow suppression, it may be seen. Then moving on to the vitamin K analogues. So vitamin K analogues, it can lead to the jaundice. It leads to the presence of jaundice. Then moving on to the tetracyclines. So tetracycline means that there is enamel hypoplasia. There may be the enamel hypoplasia. Next is the sodium bicarbonate. So in sodium bicarbs, it can lead to the intraventricular hemorrhage. Intraventricular hemorrhage. Then comes the presence of the amphotericin. So under amphotericin, there can be anuric renal failure. Anuric RF, that is the anuric renal failure. Then looking at the indomethacin. Indomethacin can lead to the oliguria. There are many factors such as the oliguria. There may be hyponatremia. Oliguria, hyponatremia. Then comes the presence of intestinal perforation. Then we move on to the aminoglycosides. So aminoglycosides. So the side effect is deafness. So there can be associated with the deafness as well as a renal toxicity. There may be renal toxicity. Next we move on to the erythromycin. So erythromycin refers to, it can lead to the pyloric stenosis. So there may be the pyloric stenosis. Then we look at the morphine. So in terms of morphine, it is the hypotension as well as the urine retention. It is the hypotension as well as the presence of the urine retention.